Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I wanted to discuss GERD and the new updated changes that have recently come about to GERD and several other medical conditions for VA disability ratings purposes. So there's been a lot of talk over the past year about new updates for several conditions, and this is just one of them that has been updated recently as of May 19th, 2024. GERD now has its own specific rating criteria, and it is no longer rated analogously with hiatal hernia, which is what it used to be rated under that sort of code. Now, I just want to throw out there, I always throw this out there, that I'm not a legal professional. I'm not an attorney. I'm not a claims agent. I'm not a VSO. I often work with a lot of those professionals. I think they're fantastic. So if you have questions regarding the specifics of ratings or how this may apply to your claim that's in process, one that's been previously done, one that you're intending to do in the future, your best bet is to follow up with one of those guys so that they can look at your specific case with you. But I think it's important to touch on some of the medical components of that disability benefit questionnaire and some of the components of what go into that GERD, what they're looking for, especially at the CMP exam, because we've done videos on this in the past, and there are some changes. So again, as of May 19th, 55 conditions were updated, GERD being one of them. So let's talk about GERD in general, right? Just a brief overview. So many veterans are service connected for GERD on either a primary or secondary basis. Either they were diagnosed in service, or it was incurred in service, or aggravated by their service in some way, or it's related to another medical condition that they are service connected for, right? So it's a pretty common condition. People will generally say they experience like a burning in their chest. Not everybody, but a burning in their chest, chest pain. They might have dysphagia, difficulty swallowing, swallowing, or painful swallowing, regurgitation of food, a sensation of a lump in your throat. So it oftentimes is treated by over-the-counter medications. I often hear veterans asking me if this is a presumptive condition related to Gulf War exposures. Again, I don't get into the nuts and bolts of what is what based on the Code of Federal Regulation, but generally speaking, digestive conditions that are functional in nature are the ones that are related to Gulf War exposures, and GERD is a structural condition, unlike IBS and some of these dyspepsia and things like that. Those are more functional disorders versus there's an actual anatomic structural disorder with the acid reflux and all of that kind of stuff with GERD. Okay. Moving on from that, let's get into the nuts and bolts of what has updated and what has changed, right? So the ratings have changed. So for one, it can be rated 80% if the person has documented history of recurrent or refractory esophageal stricture causing dysphagia with at least one of the following symptoms present, to include like aspiration, undernutrition, and or substantial weight loss. 50% if you have a documented history of recurrent or refractory esophageal stricture causing dysphagia, which requires at least one of the following: a dilation 3 or more times a year, dilation using steroids at least 1 time a year, or esophageal stent placement. 30% if the person has documented history of recurrent esophageal strictures causing dysphagia, which requires dilation no more than 2 times a year. 10% if there's a documented history of esophageal stricture that requires daily medication to control dysphagia, otherwise asymptomatic. Or 0% is a documented history without daily symptoms or requirement for daily medication. So a lot of that is really like wrapped into that esophageal stricture, which is sort of like a newer component being at all those different levels. So let me really quickly go over this new DBQ. So I'm going to present that real quick. Hang on. Here we go. All right, so here's this DBQ, this updated DBQ. Esophageal conditions including gastroesophageal reflux disease, hiatal hernia, and other esophageal disorders. So there's often, I'm going to see if I can make this a little bigger for y'all. There's often more than one condition that can be reviewed on a DBQ. So there's not thousands of DBQs, right? So let's just jump on down to the portion about GERD. So this first page is about which records were reviewed, diagnosis, list the claim diagnosis. This is where they would check GERD, right? If you have GERD, and they would put the codes and the date of diagnosis. If you've got other conditions, they might check those as well, or they should check those. Okay. And then medical history. The doctor is going to describe your medical history. What medications are you taking? Signs and symptoms. Does the veteran have any of the following signs and symptoms or treatment requirements due to any esophageal conditions, including GERD? So yes or no, without daily symptoms, without requirement for daily medication. Does the person have difficulty swallowing or dysphagia, requiring daily medication to control dysphagia? See how these are like kind of connecting to those things that we just talked about. Documented history of esophageal stricture. And then it has this important note here that they must be documented on barium swallow, CT, or a EGD. Okay, so you can't just say, hey, I have an esophageal stricture because you think you do. Like, it has to be documented somewhere, right? Has it been recurrent or refractory? It says C note 2. Recurrent is defined as the inability to maintain target esophageal diameter beyond 4 weeks after the target diameter has been achieved. Refractory esophageal stricture is defined as the inability to achieve target esophageal diameter despite receiving no fewer than 5 dilations performed in 2-week intervals. Again, requiring dilation, requiring an esophageal stent, aspiration, undernutrition, substantial weight loss, treatment with surgical correction, treatment with a PEG tube, other. Okay, and this is all about Barrett's esophagus, so we'll kind of breeze by that, which is a different condition. Where's the GERD stuff? Tumors. Other pertinent physical findings, diagnostic testing. They want to know all about the diagnostic tests you've had, if you've had an EGD or a CT. Labs. Okay. And then functional impact. How does that affect you at work? So I guess let me see if we breezed over it, if that was the section, actually. I think that was the section on GERD specifically. Let me see here. Signs and symptoms again. Yeah, so they're kind of asking about it specifically here. All those related things that go into the rating criteria. Okay. So I hope this was helpful, you guys. Let me jump off this screen share. Let's see. Okay, I hope this was helpful so you guys get a better understanding of the new sort of criteria for GERD, that esophageal stricture plays a large role in that. And please drop some comments if you guys have any questions. And as always, thank you for watching, and see you guys later.